Hello, I'm Charlie Maloney, President of Shin Imaging Center. When someone has suspected traumatic brain injury, it is common to order an MRI of the brain. A standard MRI of the brain is an important tool to detect certain types of traumatic brain injury, for instance where there is bleeding in the brain tissues. However, if the standard brain MRI comes back normal, that does not necessarily mean that no brain injury exists. Fortunately today, there are a number of other imaging techniques that the doctor can consider to identify more hidden brain injuries. Today we'll talk about several of these techniques offered at Shin Imaging Center, namely diffusion tensor imaging, susceptibility-weighted imaging, diffusion-weighted imaging, and neuroquant. Diffusion tensor imaging, known as DTI, is designed to examine fluid pathways in the white matter of the brain. If these fluid pathways are disrupted, that may indicate damage to neural transmissions in the brain. Dti Imaging uses very specific scanning sequences and sophisticated software to produce fiber track and color map images which can be interpreted by specially trained neuroradiologists that work at Shin Imaging Center. The fiber track images literally show the fluid pathways. Any damage to these pathways appear as blunting of these strands. The color maps show the fractional anisotropy or FA values of the various parts of the brain. Simply put, the FA values are a measure of the consistency of the fluid flow and constrictions in the brain. When compared to baseline brain values, the FA values are another tool to identify disruptions in the fluid flow. Neuroquant provides volumetric measurements of brain structures and compares the volumes to a normative database adjusted for age, gender, and intracranial volume. The Neuroquant Triage Brain Atrophy Report provides physicians a quick reference and in-depth look on regional and global brain structure volumes which could recur as a result of brain injury. Diffusion-Weighted Imaging, or DWI, should not be confused with the more advanced technique of DTI. Diffusion-weighted imaging is the most basic technique of measuring the relative diffusion or free flow of fluid in various parts of the brain. Developed in the 1990s, it remains a useful component of a total imaging strategy for diagnosing traumatic brain injury. At Shin Imaging Center, DWI is considered a standard sequence we employ in all brain MRIs. SWAN, or susceptibility-weighted angiography, helps clearly delineate small blood vessels, microbleeds, and large vascular structures in the brain. SWAN is also designed to distinguish iron and calcium deposits from fresh blood by providing both phase and magnitude images to aid in an easier diagnosis. SWAN consistently generates very conspicuous images of microbleeds with dramatic contrast. Again, SWAN is considered a standard sequence we employ in all brain MRIs at Shin Imaging Center.